So we'll discuss about some key terminologies. Alright. So if you're a medical student watching these things, probably you heard your consultant talk about it. Then if you're just a woman watching this thing, probably you heard like nurses talking about antepartum, intrapartum, postpartum. So they are just words that we use, to talk about the stages of pregnancy. You understand? So we just describe them, and you find it funny that it's even a normal thing. All right. So medical professionals just have the way they communicate, so that you understand. Patient is not following up. So antepartum just simply means before birth. A pregnant woman before she gives birth is in antepartum. Intrapartum is just simply a pregnant woman when she's giving birth. So during birth, during the delivery. Postpartum, after she has given birth. Right? So this will actually help medical professionals basically know the various complications that could occur before birth, during birth, after birth. You understand? So it's just terminologies that are used to describe the phases of pregnancy. So that these three terminologies, they represent the key phases of pregnancy and childbirth. So I've described them, but let's still explain it. This mostly be important to students or maybe women who want to actually know more. So antepartum just simply means before labor. You are pregnant from that 1 month to 9 months, before you give birth. So it refers to the period before during pregnancy, but before labor. You are pregnant, but you have not given birth. Okay, begins at conception. Right there, when there's sex, there's fertilization of the sperm. Antepartum begins. So it continues until your woman tell you that I'm feeling some contractions. All right. So it focuses on prenatal care. Now, for the healthcare people, there's a different care you give to a woman that is pregnant but not giving birth. Has not given birth. There's a different care you give to a woman that is giving birth. There's a different care you give to a woman that has given birth. All right. So you monitor for the prenatal care. You can be monitoring the mother and the fetal health. You can manage conditions like if there's gestational diabetes, or if the mother is having some hypertension, that's preeclampsia. All right. You can be providing education on the woman, for the woman, for her to know that right now her body is housing 2 people. She needs to eat properly, the types of food she should eat. She should stop taking alcohol. If she smokes, she should stop smoking. All those prenatal things that they take women to the hospital to teach them. Right? So exercise, she should be doing exercise, birth planning. So common assessment, they can also be doing things for you like ultrasound. They can be doing blood tests. They can be trying to check how your baby is moving, how your baby is breathing, how your baby is presenting, and all of that. So intrapartum just simply means the period from the onset of labor till when the baby comes out. So this one is shorter, all right, but it's crucial. So emphasizes monitoring labor progression, emphasizing trying to manage the pain of the mother, letting not be too much, ensuring the fetal well-being, responding to complications like fetal distress or if the labor will get too long. All right, so it's a high stakes, high focus phase where quick decisions need to be made. It's a short period, unlike this other one that lasts for almost 9 months. This one is just within some few hours and you'll be done. So the right decisions have to be made. Then postpartum, after you give birth. All right, so it begins immediately after childbirth, typically lasts 6 to 8 weeks after childbirth. Right, so though recovery can extend longer for some women. Okay, so it involves physical recovery, uterine evolution, healing from tears. If the woman has cesarean section, the mothers are usually vulnerable at this point. So ask the husbands, bro, people should train boys to be able to take care of a lot of things that girls should do. All right, washing plates, cooking is not the gender stuff. During this time, you don't allow your wife to do any work, bro. If it is not exercise, you pet her to the core. She brought a child for you. Okay, so emotional adjustment, breastfeeding support, and newborn care. Follow-up visit. This is when women that have given birth, they still visit the hospital. Okay, so this is the postpartum period after delivery. Okay, so that's the meaning of these terminologies as related to what? Pregnancy and delivery.